Hi, I'm Arva.
I'm Gracie.
And I'm Yuritsa.
And I'm Brooke.
And you're watching SLPeasinaPod, episode 5.
Yay! We're here and we have a guest.
Yes, we do. We have Brooke Renee. Brooke, we are so thankful that you're here today. Can you tell us about yourself a little bit?
Yeah, so I am a medical speech pathologist in the Kansas City area. I cover a couple of different settings in our field. I am full-time in acute care, but I also float and cover outpatient, inpatient rehab, and then I work in the skilled nursing facility setting, PRN, and most recently accepted a position working as a clinical supervisor. I'm super excited about that, and it'll be interesting because of COVID. It'll be telehealth the first part of the year, and then after that I'll travel to various states supervising in person, so I'm super excited about that.
That's so exciting.
Wow, that's awesome.
Yeah, so like I said before, we're so excited to have you, and we asked some of our viewers to ask us questions, and we got a ton of great ones in. So we're going to take some turns asking you some questions, and you can let us know what you think about these questions and any advice you have for graduate students or CFs. All right, so our first question: how do you maintain your hobbies while still being an SLP?
Yeah, so for anybody that follows me on social media, you know that I spend a lot of time in the gym. I like to powerlift, and I'm going to nationals in the fall. So a lot of my free time is dedicated to training for that, and I enjoy it because all my friends do it. That being said, it can definitely be a hard balancing act of, working full time and having several jobs, and also maintaining hobbies and relationships and things like that. But I always think that if it's important to you, you'll dedicate time to it. So I am definitely a type A SLP. I have my week planned out. And like we were saying before we started the podcast, things can change daily in acute care. So sometimes my schedule doesn't really work out how I want it to. But I try to be flexible while still maintaining those goals. So for example, my training is typically 4 days a week for powerlifting, but if I need to, I can split one of the days in half and get the rest of the training in on the weekend or something like that. So I think it's really just making it a priority. I know when I was in grad school, my best friend is also a speech pathologist, and we would work out and study simultaneously, which was interesting. But there's actually some research that indicates that working out while learning is a really great way to integrate the knowledge and actually learn it better than just sitting at a desk. So that's kind of interesting. So if I do cardio or something like that, a lot of times I will put on a speech pathology related podcast or something like that, just so I'm still absorbing educational content while also doing something else. So I think just trying to fit it in a way that fits your lifestyle. Like they always say about dieting, the best diet is the one that you can stick to. So finding a routine that fits with your schedule, and like I said at the beginning, just really trying to make it a priority. If it's important to you, then you'll find the time to squeeze it in.
It's a great answer to that question. I feel like it's hard to say that you're gonna dedicate so much time to something, and then if you don't want it enough, it's hard to do that. So I think it's amazing that you've made enough time to do something you love while also doing the career you love. So that's great.
Yeah,
I think it's awesome that you lift. I think that is amazing. I love that. I really do. You can be an amazing medical speech pathologist, but you could also compete and do your lifting. That's awesome. I love it.
Yeah, it's really cool too. There's actually quite a few medical SLPs that I found on Instagram that powerlift as well. So it's cool to connect on that level. And then what's really interesting, and I talk about this a lot on social media, are the correlations between powerlifting and swallow rehabilitation. So, in school, we don't really learn about why we would prescribe certain sets and reps. Nobody talks about that. They just say, oh, here are some exercises, recommend these if you see this impairment. But nobody talks about prescription. How often should this patient do this? And why are they doing it this often? And so that was something that really bothered me right out of school, because the bulk of my caseload were patients that had swallowing impairments. And I just felt really lost, and I didn't really understand how best to help my patients. And so that's been a huge learning curve. And it's been really, really fun to see like I said, the correlation between my powerlifting programming and then what I do in for my patients with dysphagia. So my powerlifting coach is great. I asked him to send me like a video discussing just how he determines sets and reps for me and RPE and things like that. And so it's really cool to apply those principles to what I do with dysphagia.
Really cool.
Wow.
Yeah, that's awesome.
So we have more questions, obviously. The next one is, what was the hardest thing about being a medical speech pathologist?
The hardest thing about being a medical speech pathologist?
Mm-hmm.
Probably the process that a lot of people are going through right now, which is just getting into the medical field. You know, I knew that I wanted to be a medical speech pathologist since I was 15. That's the whole reason I went to grad school. And, you know, coming right out of school, I was one of the only people at graduation that didn't have a job. And it was just really disheartening because I knew the whole time that I wanted to work with adults, that I wanted to work with people who had swallowing impairments. And it was honestly really disappointing. And just frustrating to, you know, have gone through grad school. I'd spent 6 years in school, and to go home and move in with my parents and see all of my friends from high school and college, like, you know, being successful in their career. And they're like, what are you doing? I'm like, I'm living in my parents' basement. Like, I don't have a job. And so I think, you know, that was really a really challenging time. But it made the reward of getting into the medical field. So it just was incredible to get that first job. And then second to that would have been my clinical fellowship year experience. That was one of the most challenging years of my life. I talk about that quite a bit on social media. It was so terrible. I almost quit being a speech pathologist in general and actually had a job lined up at a local gym because I was so disappointed by my experience. But I always think that everything happens for a reason, as cliche as that sounds. And things did a 360, and I refound my passion and have just been immersed in speech pathology ever since, as you guys know.
I relate to the feeling that you have. We were talking about this before the podcast, but, you know, finishing school, all your friends have jobs, and like you're living in your parents' basement. I'm just living back at home, but I completely understand how that feels. But I also believe, like you said, that things happen for a reason. But I'm sure that that's only made you stronger in the long run.
Yeah, we've spoken about how everyone has their own journey, and I think that's so important to realize, and for our listeners to understand that not everyone is going to go through the same journey as, you know, you compare yourself to your friends and the people around you, but you need to have faith in yourself and that it's going to work out.
Definitely.
Okay. All right, so our next question. How long did it take you to find a good work/workout balance? And do you think it's better in the morning or in the afternoon?
So that's still a work in progress. Like I was saying at the beginning of this, I'm working still on setting boundaries. I graduated in 2017 and we're in 2020, and I still I have, you know, multiple jobs, and like I said, I do spend quite a bit of time in the gym. So, you know, it's just seriously a work in progress. Some days if I stay later at the hospital, that means I'm going to, you know, cut my workout short or change it to a different day. As far as time, like morning or evening, I used to work out at like 4 a.m. every day. And I do love that, like working out super early, because then when you're done with your day of work, you can just go home and relax or do whatever you need to do. However, for powerlifting, I found that that's not optimal for me because I'm, you know, getting up then and training on an empty stomach versus if I have the whole day to eat and stay hydrated and stuff like that. And that's better. And then when I get to the gym, there's actually people there to help me, because when you're trying to hit really heavy numbers, it can be honestly kind of intimidating if you're in the gym by yourself. And a lot of my friends work out in the afternoon. So it's kind of like a 2-for-1. I'm getting to do something I love while also being with a great community of people. So like I said, kind of give and take.
Has COVID changed your ability to do your hobbies at all?
Yeah. So when we had the stay-at-home order, that was really hard for me because powerlifting, well, just working out has been an outlet for me for a long time, since undergrad, but powerlifting specifically for the past couple of years. And so obviously we couldn't go to the gym or anything like that. So that was really hard because part of the reason I'm in Kansas City is because of the gym community. And so that was hard, just not seeing my friends and not having that as an outlet. My coach is great. He gave me some stuff to do at home, and I did workouts outside, and I also really like yoga, so I did a lot of yoga, which was great. But yeah, COVID did throw a wrench in that for a while, but luckily things are opening up back here in the Midwest. There's precautions and certain things we have to follow, but overall, that's a big portion of my life, and that's returned to normal, which I'm very thankful for.
Yeah, I mean, I think working out is such a huge boost in your day, in your mood, and just like incorporating that. I always like to, at least if I'm just walking for 30 minutes, I'm happy. So I can only imagine when you have that ingrained into like your daily schedule and it's something you prioritize, how hard it is to manage all different aspects of our lives, not just being an SLP. It's, have to kind of manage everything.
Mm-hmm.
Okay. So our next question is, do you think it will be hard to transition from a school setting to a medical setting?
So I will preface this by saying I have not transitioned from a school to a medical setting. I have mentored a couple of SLPs that have done this, and I know a couple of SLPs that have done this, and I think it's fairly similar to getting into the medical field as a new grad. Obviously, it's a different ballgame, the medical setting compared to the schools, but I think there are things you can do to optimize your opportunities for entering the medical field. I would say if you can start by working PRN somewhere, if you're in a school and then you could get maybe a PRN position in a hospital or a skilled nursing setting on the weekends or when you get off of school, that is a great entryway into the medical field. I have a couple of people that I know that did that. They started PRN in a SNF and then got a position PRN in the hospital and slowly eased their way into the medical field full time. In addition to that, doing CEUs and courses specific to the area that you're wanting to work in, and then networking, which again, I talk a lot about this stuff on social media, but just getting out there and, connecting with other SLPs. Social media makes it so easy to do that. But following people on Instagram, talking to people on Instagram, same thing with Facebook and LinkedIn. There are so many ways to connect with SLPs. And then just also, as depending upon your area, if there are local medical speech pathology groups, like going to events like that. We have a group here in the Kansas City area that I found out about, and I went to it and I met so many SLPs in the area that I didn't know previously. And it was really cool for me because I met and some SLPs in the skilled nursing setting that my patients actually were getting treated by them. So patients that I had seen in the outpatient setting that ended up going to skilled were working with these SLPs. So it was really cool to connect across that continuum of care. And then I ended up applying for and accepting a job in that same skilled nursing setting because I had met the SLPs. I knew them. I knew, where their values were and that it would be a great opportunity. And so I think that that's always another great way to connect and network with other SLPs in the area, because then they see you, they know they've seen you in person. They know that you're motivated to learn and make those connections even in your free time and your days off and things like that. Again, I'm in the medical field, but right out of school, I reached out to a lot of SLPs in the field and asked if I could come shadow them. Like there's a mobile video fluoroscopy van in the area. I contacted that SLP and asked if I could come shadow her on my day off. Just things like that. So that for one thing, you're continuing to learn, but also you're making connections with people. So maybe, an opening comes up and they're like, oh, I remember so-and-so, she's in the schools, but she said that she really is interested in being in the medical field. I'm going to contact her and see if she's interested in helping out for a couple hours a week or whatever. But, I think that it's just all about putting yourself out there, and yeah, it can be time consuming, but if you really want it, it'll definitely pay off.
That's great. And I also, since you're talking about networking, but I think it was you who told me to do the finding the Facebook group within your city or your state. So I actually joined like the New York SLPeas group, and everyone shares such valuable information, whether it's like job openings or just like different cases they want opinions on. Like even off of that, the Medical SLP Collective has a Med SLP Newbies Facebook group, and students who are like in their graduate school have questions and like other SLPs answer. So I think networking is like one of the best things to do.
Yeah, I definitely agree. And like, you know, like you said, like joining those groups that are specific to your area, people will post job postings in those groups. And it's even just a good opportunity to, you know, test your knowledge, but also showcase what you know. Like, you know, for people that are transitioning from the schools to the medical field or right out of school, like you guys are motivated and actively learning this information. So when you get on there and you see somebody has a question about a case and you're like, oh, I know about that. And you know, you reply to them and you start linking articles, like it's all about just sharing like what you know, and then people will start to be aware of that. Like I get tagged and stuff in random medical groups on Facebook all the time, just because some of my friends are in there and they're like, oh, well, I know that she's really into head and neck cancer, so I'm going to tag her in this and see if she can help. And that's a great opportunity, because then maybe they're like, oh, well, I have this opportunity in New York to treat head and neck cancer patients. I wonder if so-and-so is interested in it, and they tag you in it. So it's just like, there's so many opportunities to make connections and possibly get jobs. There's a lot of really well-known SLPs on Instagram that for a while were posting to their stories like open clinical fellowship opportunities and externship opportunities and things like that. So I think social media is a really, really powerful tool as far as that stuff goes.
Thanks, Brooke. So our next question comes from some of the graduate students right now who were really curious to see their next step and what your next step was. And you kind of touched on this a little bit already, but what setting did you do for your CF? I know you said it was a little bit of a hard year for you, but can you elaborate a little bit more on what happened that CF year?
Yeah, so the position, and you know, I find this a lot. People will apply for a job and you're not quite sure what the position is. And so I applied, and it said acute care, but it turned out that it was outpatient and acute float, and then it turned into also covering inpatient rehab, because a rehab unit was built during my clinical fellowship year. But it ended up turning out to be primarily outpatient, which I never knew that I would like outpatient, but I actually really, really like outpatient, because you really get to build those relationships with your patients and get to know them on a personal level that you don't always get in acute care. I mean, you do get that, but not for the duration of time typically. So to elaborate on why it was a hard year, part of the reason that I took the position that I did was I really wanted a mentor. I had a couple of different opportunities to choose from as a clinical fellow, and I chose the one that I did because of the mentorship. And, you know, I talk to SLPs that I help on Instagram about this a lot, because they'll say, you know, I really want a mentor and I think I'm going to go with this position, even if it's not the one that they really want, but because of the mentorship. And that's what I did, thinking that I was going to have a great support system and a great mentor. And it turned out to be a year out of a nightmare. It was honestly terrible. I won't go into like all of the details of it, but basically I learned nothing about speech pathology from the person that was supervising me, which was extremely disappointing. It was just more about logistical things that have no relevance to patient care. It was very disheartening to hear certain things about patient care, like, you know, patients being told they would never eat or drink again, things being done that, you know, may have had evidence behind it 10 or 15 years ago and having no relevance to date. You know, I can recall doing some video swallow studies and telling a patient that they were within functional limits because they had laryngeal penetration one time and cleared the material, and I kept them on a regular diet and thin liquids, and being told that I was wrong and that was wrong to do that when it is not wrong to do that. As a clinical fellow, I was way too scared to say anything. I mean, I did what I needed to do for my patients and I ensured that I was ethical and all of those things, but it was scary because, you're already questioning stuff because you're a clinical fellow and you want to do a good job, and you want to help your patients. And so it was frustrating. There's a lot more to the story than what I'll go into here, but it was extremely stressful. I cried and threw up just about every day. It was very terrible. And I was the 5th person in that role in 5 years, if that gives you any idea of how stressful it was. So the good thing is that things changed and the team changed for the better, and it became an amazing, amazing, amazing place to work. There was other people around my age there that were extremely supportive, and there were some other people in other disciplines that were there that kind of took me under their wing and helped mentor me, not in the realm of speech pathology, but just in terms of like leadership and being able to do the right thing. Not that I didn't want to do the right thing, but it can be really scary as a clinical fellow to, like I said, stand your ground and be able to say, this is wrong. So it was a huge learning opportunity in terms of that stuff, but it definitely made me a stronger person. And I know that after surviving that year, I'm not really scared about working anywhere because I know that nothing could trump what I went through as a clinical fellow. And then that did push me to reach out for mentors in our field, to help make me a better clinician. Like we said, I had reached out to Teresa Richard, who does the Swallow Your Pride podcast. And by meeting her, I met so many other SLPs in our field who are very successful and leaders in our field. And it's been a huge learning curve for the past couple of years, but it's been really, really good.
I'm happy someone like you decided to become a supervisor because, especially when a bad experience has happened to you, it shapes the way you're going to mold the future SLPs. And that's really great to hear.
Yeah, that's why I offer, free help and information on Instagram, because I've been where you guys are. And there are so many people in our field who want to help and they want to learn. And unfortunately, it seems like sometimes, or at least it seemed like to me, that it was hard to find the information and hard to find somebody who was willing to sit down and talk through it with you. And I think that's all anybody wants. Everyone wants to do a good job. And we don't have to be mean about it. I just don't understand that. It just blows my mind. So that's, has been really exciting that this company reached out to me asking if I wanted to be a supervisor. They had seen what I was doing on Instagram and just thought that I would be a good person for it. So I'm really excited about it because I just want to help other SLPs. I think that if we come together as a team, we can serve our patients much better.
Speaking as someone who has gotten your help, I will be your reference any day. You are so helpful and so nice, and I think that it's so refreshing to see someone like you who has everything. It seems like you have everything together. I know that maybe in reality you don't think you do, but it seems like you have the perfect life from the outside, and I just feel like it's so nice to get some advice from someone who's been in the field, who knows what it's like, and who's gone through every up and down you can think of. So always thank you for everything that you do for everyone. We appreciate it.
Oh yeah, no problem. And I will definitely tell you, I was laughing yesterday because a friend of mine had messaged me and was like, do you ever feel like you're 16 steps behind? She's like, well, I'm sure you don't. And I was like, oh my God, taxes are due in 9 days, or well, now less than that, but I hadn't even done my taxes yet. And I was like, it looks like it looks like I have stuff together, but I don't. I'm just like everybody else, so, but yeah, I just like to share all of the speech related stuff on social media because I feel like we can learn in a fun way. Some of the stuff I post, people are like, oh my gosh, I never knew about this. And I don't think it has to be intimidating. I don't think it has to be overwhelming, which is how some of the topics felt in grad school when they put so much pressure on you. And it's people don't learn well in that type of environment. Like, let's have an open discussion about it. And so much of what we learn, you have to apply it in a way that fits the specific situation that you're in. Because when you're in the medical field, it's not like it's going to be a textbook presentation every single time, you know? So it's really just learning the information and being able to apply it critically.
Yeah. Wow. And you know, it's so good that we have someone like you. I'm just repeating it one more time.
Thank you.
You know, I just have to repeat it. So tell us a little bit more about your experience once you finished your clinical fellow. Did you work PRN, or did you have to do that when you started out? Like, just explain it a little bit more.
So the position as a clinical fellow, like I said, originally it was a like 50-50 split, outpatient, acute care. And then I really wanted to build a head and neck cancer program because there wasn't one prior to me coming there. And so I worked really hard on that and built that up. So then I ended up being primarily in the outpatient setting with acute care on the weekends. And then the hospital also built an inpatient rehab while I was there. So I would cover that as well. And then, like I mentioned, I attended some of the CEU events here in the Kansas City area and connected with SLPs there, and found out that a colleague of mine was going to be moving. So there was going to be a position open up at a skilled nursing facility in the area. So I was like, well, I would like to try that setting too. And I had become friends with the lead SLP there. So I decided to go ahead and work there. And then, you know, I got really into Instagram and just sharing my journey as a SLP on Instagram. And I started just connecting with other SLPs on Instagram, which led to me eventually working on the Med SLP Collective team. And that snowballed into a full-time position. I was originally just doing it like on the side while working full-time. But the collective, if people that are listening don't know about it, it's literally incredible. I highly recommend that you guys should check it out because it was a game changer for my career. But that snowballed into a full-time position. So I ended up doing that full-time and then working at all the jobs I just said, PRN, which was cool that all of my supervisors and team members were okay with me doing that. And then I just recently came back to patient care full-time because a hospital out in Kansas had reached out to me and asked if I would help start their head and neck cancer program. And, you know, like we said, I think that everything happens for a reason. And I just feel like I am called to work with people in person. And I just really missed being able to have the opportunity to do that and see patients make progress. You know, I mean, you see it PRN, but you're there and then you're gone. So it's a little bit different when you're there full time. So I made a really tough decision to go back to patient care full time. And because of COVID, things are kind of moving a little bit slower as far as getting that program up and running. But it's been really nice to be back in patient care full time and to see patients across the continuum, because I'll see patients, you know, in the ICU and then in the rehab unit and then get to see them on outpatient. So it's really cool to be able to see that, like I said, that continuum of care. So that's kind of been my journey so far. And then the clinical fellowship thing, I was kind of looking around at some positions, just PRN, to get other experience because I've never worked in home health. So I was like, well, maybe I should check that out too. And then it turned out that the place that I applied, they had seen me on Instagram and were like, oh, we want you to be a clinical fellow supervisor. So that's how I got into that. So yeah, and then I've got one other thing in the works, which I will tell you guys about after I have a meeting about it tomorrow, but it'll be very specific to head and neck cancer. So when I know more about that, I will let you guys know.
Thank you.
Thanks. You are all the goals, Brooke. All the goals.
Yeah, no stone left unturned. Wow.
Literally. So my next question is a double-sided question. Do you have a preference, for which setting you enjoy working in the most, and what specialties do you enjoy?
That's a tough one. I definitely, my favorite thing is working with patients who have dysphagia. Like I said at the beginning, I love applying the principles of exercise physiology to swallowing. I like to nerd out on that stuff. And more specific than that, I really enjoy working with patients who have had head and neck cancer. When I was in grad school, some friends of mine, we just decided to go on a road trip to MD Anderson to a laryngectomy conference. And being there and being surrounded by those SLPs, I was like, oh my God, I want to do this. And so it's been really cool to actually have that opportunity so early on in my career. I really enjoy getting to work with that patient population, because some of these patients, 10 years ago, people would write off and say, like, you're not ever going to be able to swallow again. Or, maybe they were fine for the past 10 years, but the tissue has become so fibrotic over the years and no one has helped them, because back then no one really knew to address it, that now they're in the hospital with aspiration pneumonia. And, I see them in the acute care setting, and then I don't want to say I love when I get those cases, because I really don't wish I didn't have a job, because then that would mean people didn't have the disorders that they have. But I love when I get those patients, because it's like a puzzle piece. Like, what are the various pieces of the puzzle, and how can we connect them, and how can we address the problem? If I have time, or if you guys have time, I'll give you an example.
Yeah, go for it.
There was a patient that was referred to us for swallow evaluation. The patient had already gone through treatment for head and neck cancer and had already gone through a swallowing program, but consistently needed an esophageal dilation. Well, they had tried to intubate the patient 3 times unsuccessfully. So he ended up being NPO in the ICU, had a lot of issues with breathing and obviously with swallowing. And so I did his video, and I mean, there was no way he was going to be able to eat or drink by mouth and be able to maintain his nutrition and hydration. And he was aspirating pretty much everything. And so that was really hard, I mean, for the patient, because he had been able to get back to a regular diet and thin liquids after going through, extensive treatment for head and neck cancer. So he was devastated, because he had had such a huge setback because of these unsuccessful intubation attempts. But what was cool was that, because I really am interested in this area of the field, I knew how to address the issues that he's having. And so, although he did have to have a feeding tube placed again, I told him it's just for the short term, like, this isn't forever. Now he's back to doing thin liquids and puree, and we're hopefully going to get him to solids here shortly. But it's just, I like it, because there are multiple factors that go into fixing what has gone wrong. But with working in an interdisciplinary team and being really familiar with those issues, I feel confident in addressing it. And so I just really enjoy doing that. Oh, I guess I didn't really answer though what setting I like. I like acute care and outpatient. I do like inpatient rehab and skilled nursing, but if I had to choose just one, it would probably be a tie between acute care and outpatient.
Okay, so our next question, you've kind of been spreading around this a little bit as you've been talking, but what advice would you give to grad students who want to become medical SLPs?
So the first thing I would say is really take a hard look at your resume. Like I said, I offer a lot of help on Instagram about this stuff, but a lot of people that are entering into their clinical fellowship year will send me, like, I've gotten some resumes that are like 2, 3, 4 pages long that are very detailed. And I mean, you guys are seriously like rock stars, and you do so much stuff and you've got so much experience. But I know from being on the hiring team myself that if a position opens up, a lot of people are probably going to apply, and we don't really have time to sit down and read through all of that stuff. So you really want your resume to be kind of like an Instagram feed, like your highlight reel. Like, what are the top things about you that make you good for this position? and making sure that you're really honing in on those things, reducing the wordiness of your resume, things like that. The next thing, like we already said, would be networking. So reaching out to SLPs. If you want, like you want to work in the NICU, reach out to an SLP on Instagram that works in the NICU that's an expert and ask him or her, like, how did you get into this? Like, what advice do you have for me? Not being scared to do that. I remember I took a vital sim course it was right after my clinical fellowship year. And one of the instructors, I was like, oh my God, I want to be her when I grow up. Her name's Kelly Salmon. She's literally amazing. And I reached out to her, and it turned out that I ended up being in the inner circle with her. And I was like seriously fangirling when I got on the first call and saw she was on there. But she's been, and I don't know if she'll watch this or not, but if she does, hey, Kelly. She's been just like somebody that I really look up to, and she's been able to give me advice both directly and indirectly. So reaching out to those people that are doing things that you want to do, because a lot of people are giving away free information online that you can learn from. And then like we said, so Facebook groups, connecting to people on Facebook, LinkedIn, Instagram, and then reaching out to other SLPs in your area. I would also say, even though you don't need CEUs as a clinical fellow, taking courses that are specific to the area that you want to be in, you're showing future employers and team members that you're motivated to learn, even if you don't need the information. And, from personal experience, a lot of times grad school really doesn't prepare you for actually getting into the medical field. A lot of the stuff that I know is from doing a lot of work in my own time. Like I mentioned, even just like working out and listening to an SLP related podcast, anywhere you can fit in that extra education, I think is really important, so that when you do get into the medical field, you feel a lot more confident in the information and how you're practicing.
Yeah, I think that's really important. I think I wanted to ask if that's something you would also tell a medical SLP during COVID. Is that kind of the same advice you would give them when applying?
About applying for jobs? Yeah. And, another thing that I always recommend is if you're willing to relocate, your opportunities really increase. I made a job log, which I do talk about this on social media as well. I applied to over 100 positions around the country. And it just really opens the door for more opportunities, because unfortunately a lot of areas are saturated. Like, I'm from St. Louis originally. There are multiple grad schools there. Even though there are a lot of hospitals, there's a lot of grad schools there, and it's a very saturated area for speech pathologists. And so there were no job opportunities when I got out of school in that area. So I just slowly started to expand the area that I was applying in. It started in St. Louis, and then a few hours out, and then eventually all the states, California, New York, Florida, anywhere. And so, if SLPs are trying to apply for jobs during COVID, it's pretty much the same recommendations that I'm saying for SLPs applying not during COVID, but just, being patient, because due to COVID, things have changed. A lot of places are on job or hiring freezes right now. So they may need help, but because of COVID, they're on a freeze. So, we kind of have touched on this before, but reaching out to those facilities, calling the DOR or the lead SLP and giving your name, giving your information, because when things do start to open back up, then they'll already have your information and be like, oh yeah, so-and-so called me and she seemed really interested. I'm going to give her a call back. We've actually, in some of the positions that I've been in, we've had that happen, and we called the person back, So I think even if you are having downtime, I know a lot of people are having downtime right now, using that downtime to put yourself ahead, put yourself out there and share the information that you know online. That's literally how I got this supervision position, because I just talk about this stuff on social media all day long, and people saw it and were like, oh, you might be good at this and you might be interested in this, which is also how why I was asked to go start this head neck cancer program, because I had done a lot of work throughout this area, hosting head neck cancer meetings and doing presentations in my free time, because I'm really passionate about this topic. And so that's why they reached out to me and offered me the job. So it can be frustrating. It can feel like you're not making a lot of traction when stuff's not happening, but I promise it does pay off. It might take a couple of months, as frustrating as that is. I will say, if times are tough financially, I have done stuff like Instacart and things like that so that I can stay primarily focused on medical stuff, but also be able to pay my bills. Like, there's no shame in doing that stuff if it's what you really want. I think that it's important to really stay focused on that instead of just settling for something that you're going to regret. Because let's say you don't want to be in the schools, but you accept the position in the schools because that's what's available to you. And then, I mean, life happens. You get married and you have kids and you're like, gosh, why didn't I ever do that? And time just will pass you by either way. So it's like, if you want something, like, you should go all in on it, I think. So.
Thank you. Yeah, I that's why I asked that double question, because I'm like, that's probably what you would give to a medical SLP who's interviewing. But I also, medical SLP who's applying. But I want to know if you have any advice for interviews.
Yeah, so I have, and actually, I guess I'll give the secret away. My blog post next week is going to be all related to questions that you might have in an interview as a medical SLP. So if you want a full list of questions, check that out. I have sent a lot of people a list that I have just like in my iPhone, because people will say, like, how can I prepare? But I'm going to add some more questions to it before I post on the blog. But, I would say go through questions with someone, go through questions, even just pull out your iPhone and practice on Instagram stories. Like, you don't have to post it, but just practice going through those questions and seeing yourself and how you respond, and talking through it with someone. My best friend, like I said, is also a speech pathologist, so we would do interview prep with each other. People can reach out to me. I'm more than willing to do interview prep with people. I also recommend that you have a list of questions that you want to ask them. And, it can be scary, again, as a CF, because you're like, just give me a job. Like, I was like, I will clean toilets if I can work somewhere. Like, please, just like, I really want to be in this field. But the thing is, like, you guys have so much to offer, like, and it can be hard to think about that as a clinical fellow, because you're like, I mean, I just graduated school, like, I'll work for minimum wage. But no, like, you guys went to school, you have the education, and you're motivated to learn. And, if you're spending the time to prep and apply and reach out for help, like, you're obviously motivated and you want to help your patients. So that's super valuable. There's a lot of people in our field who are burnt out and they've kind of lost their drive. So I think it's really awesome when you get someone new on the team that is driven. And honestly, I would rather have somebody on my team who is open to learning, who's open to going the extra mile, that might need more help as far as like evaluations and treatment go, than somebody who thinks that they know it all, but they just want to clock in and clock out and they don't really care that much. Does that make sense? And so I'm kind of losing my train of thought. Oh, you said interview. Yeah. So then I would say, ask them, like, have a list of questions that you want to ask them, because you're also interviewing them. You want to see what are the team dynamics like? Are you going to have access to instrumental evaluations? Because what if you accept the position and then you find out that it's a 6-week wait period for a video? How are you going to do your job? And it's like, you don't want to get yourself into a position where you can't do your job because you don't have the tools to do your job. And then a big one is asking about productivity. What are their productivity standards? If they're going to say 95% productivity, like, you can't go to the bathroom. You can't help, you've got Sue down the hall who is having trouble getting her socks on, and you really want to help her, but you can't because you have to run to the next patient. And then that leads into clocking out to document and stuff like that, and just a whole mess. And it's like, you want to be in a situation where you can do what's best for the patient and still get your job done, but do what's best for the patient and not get in trouble for it. And that's been a huge thing for me whenever I interview, and at all the places I work. I love it because I know that every place that I work, I can go the extra mile for the patient and I'm not going to get in trouble for it. And I feel terrible for clinicians who are not in that position, because I know there are a lot of people around the country who they do have to worry a lot about productivity. And I'm very blessed that I do not have to worry about that, but that's something that I always ask about in an interview.
Thank you for that insight. I know that's the scary part when you're in an interview. You forget that, like you said, you'll clean their toilets if they accept you. But it's also, you have to remind yourself that you also are interviewing them, and you have to see if it's a good fit for you. So I think that insight is actually really helpful.
I think it's hard when you're interviewing though, because I think we have this like imposter syndrome mindset, like straight out of grad school. It's like, you know everything generally, but you feel like you don't know anything. Like, I don't know how to explain it any better than that. Like, I feel like I'm knowledgeable, but I'm like, am I knowledgeable? I sit there and I kind of marinate and like, am I doubting myself too much? So it's hard to remember that in an interview, but I think asking them questions is the best thing because we're also interviewing them, which is what I think I forget a lot too.
Yeah.
And then our last question from the viewers is, did you gain experience in all settings in grad school?
No. Of course not. Actually, since I knew I wanted to be a medical speech pathologist, and at the time I thought, I only wanted to do acute care, I actually set up my externship myself. I knew of a speech pathologist in the St. Louis area who was willing to take on grad students, and so I contacted her to see if she'd be willing to take me on, and then I set it up through my grad program. I know that's not the case for every grad program. Like some places won't allow you to do that, but I highly encourage asking about it because had I not done that, I don't know that I would have got that acute care experience. I may have ended up in skilled or something. And not that you can't get into the hospital if your position that you had as your externship was in skilled, but I feel like it's a lot harder just from a learning curve standpoint. And then also as far as applying for jobs, if I see an applicant that does have experience with video fluoroscopy and fees, that could be a potential bonus for them in comparison to somebody who has not had it. Again, it in my opinion, it comes down to the interview process, meeting them face to face and seeing if they're open to learning or if they're into evidence-based practice, because you can have somebody who has experience with video fluoroscopy and fees who their report is what I posted on Instagram the other day, aspiration, one time, fail, NPO, so, there's multiple factors that go into it, but yeah, I did not learn about all settings. I mean, I learned about them, but I didn't get experience. I only had experience in a school and then acute care. And then I did stuff in my own time. Like I said, going down to MD Anderson was all out of pocket one summer for fun. And then a lot of learning just on the side, like I said, shadowing at skilled facilities. And then during my clinical fellowship year, reaching out to other SLPs in various settings, because we all do similar things, but it's all different at the same time. Like I said, I've never done home health, so that's a totally different ball game than anything that I know how to do, and I would love to get my toes in that at some point.
I also had another question. It's aside from the viewers, but I wanted to hear more about what it was like for you starting the head and neck cancer program and what kind of pushed you to doing that.
So, okay, there's some disorders and some diagnoses that sometimes things are a terminal diagnosis. We know that. It's healthcare. Patients are going to die, as hard as that is to deal with and accept. But I think that if we can provide hope, then we need to do that. Obviously within reason. Don't, if you don't know for sure, don't be yeah, 100% you're going to go back to exactly how you were, because no matter what you're going through, for example, let's say a patient has head and neck cancer and I'm confident that they can go back to regular and thin liquids. I'm not going to say you're going to be exactly how you were before, because they're not going to be exactly how they were before. This is a chronic thing that they're going to have to manage, and it's emotionally traumatic, just like having a brain injury that can change you for life just from even an emotional standpoint, but I think it's important that we as healthcare providers provide hope, but also we provide hope based in evidence, if that makes sense. So that's really what pushed me, because a lot of these patients were not getting seen. They just were going through treatment. They were getting a post-treatment video swallow study, and being told, okay, your swallow is this much impaired. Here are the impairments. Here's the diet recommendations. And you're going to be stuck on this for life, whether that's honey thick liquids or a feeding tube. And I just did not feel like that was it. Like, how could that be it? That's it. We don't have anything that we can do. And so, like I said, I had seen all those SLPs done at MD Anderson, and I was like, oh my gosh, like, this is incredible. The work they're doing is incredible. And so I started reaching out to other people in our field and just really immersing myself in information about head and neck cancer. And, I'm sure you guys know it's not like a aphasia where we have so much information on it at your fingertips. It really is not like that. But there are so many people that are doing this and being pioneers in this area that there's enough research out there and information out there to get started. And so that's what pushed me to do it. It was definitely scary because I had just finished my clinical fellowship year when the cancer program, like the cancer center itself, was really all the way completed. And so I went and presented to the physicians, and it was very scary. You mentioned imposter syndrome. I 100% had that. I was very scared because I'm like, I already look 12 and I just graduated. So one thing I did was I brought them breakfast and coffee because I'm like, well, okay, let's win them over with food first. But then, I just think that most people are in healthcare because they care about people. So I talked a lot about, what I had seen with my patients, like being so upset because they couldn't go to, they couldn't eat at their son's graduation barbecue, or they couldn't have coffee with their wife, and like telling them stories like that to really show them like how swallowing affects the person, like their quality of life, because you have to think doctors are saving the patient's lives, and then we as therapists can help give back a quality of life. And obviously, some of what we do is also can be life-saving. But I think just, kind of helping them understand that perspective. But yeah, it was a time-consuming thing because things don't always move extremely quickly. You have to have processes in place as far as the way things move. Specifically for head and neck cancer, when the patient gets diagnosed, what happens first, second, third, all that stuff. We were eventually able to get it set up where they would see the physician, and then I would be their next appointment that same day, and they would come and talk to me, and we would go through, what things they may experience, why they should come for an instrumental evaluation before they start radiation and chemo, if they were going to have both things. And then also after everything was over, then we would also do another instrumental evaluation to compare the two. I kept a lot of files on patient progress and would do like intermittent follow-ups for a year after treatment typically. And then that allowed me to create data to continue to show the hospital why this was beneficial, and to show the doctors like why it was beneficial. And we started a support group, which was really cool. And we just had monthly team meetings where we would meet and go through each patient that we had ever seen and like where they were and the progress that they made. And so, yeah, it was a really, really, really amazing part of my career. And I'm excited to be able to kind of get started in that again.
I think I speak for all of us when I say like everything you just talked about is like why we love medical speech pathology so much, and like why we all feel so passionate and compassionate about our patients, and we do. So I think it's so nice. I feel like we see so many SLPs, or I feel like I see so many SLPs who are talking about burnout a lot, or about how the job just isn't doing it for them anymore. And like that's like one of my fears, is that I'm gonna get to a point where it's gonna be like, oh, was it not to do anymore? But seeing you, like you've been in the field for a while, you still love it. And I like that drive is what I like aspire to have and to continue to have.
Actually, you bring that up, and I just had a conversation with a coworker earlier this week who's been in the field way longer than me, like more than 10 years, and saying, talking about burnout and how it's easy to be burnt out. And it's just like with anything, it's like with working out. For example, I used to work out at a regular gym, just like a regular gym, and I never got better. I literally lifted the same weight for like 2 years. I never got better. So I did something really scary and joined a powerlifting gym in my area that's ran by one of the best powerlifters in the world. He's a world record holder, and I knew all of the people at the gym are incredible lifters, and I knew, one, I was going to be humbled, and two, I was going to learn so much, and hopefully I would get better. And I literally have improved so much that like I changed, like, for example, whenever I first started working out there, my PR squat was 210 and I hit 265 like during quarantine. So like just the growth has been just exponential, and my confidence in lifting. It's the same for speech pathology. If you just stay in your same bubble and you never experience anything, you're going to get burnt out, because I mean, how could you not? Because you're not learning anything. You're not challenging your thoughts. You're not challenging your practices, and you're not experiencing anything else, you know? And if everybody else around you gets complacent, then you're just kind of like, oh, well, this is how it is, and I'm going to clock in and clock out, you know? But that's why I love CEUs and live events and stuff like that, because then you get to meet other SLPs and hear what their experience, and you also feel so empowered when you come back and you have that new knowledge. Like, for example, with the head and neck cancer program, I had taken some courses on myofascial release, which is now more commonly called manual techniques, or manual therapy. And I had taken some courses on that, but I didn't feel extremely confident in my skills. So I put in a request for Walt Fritz's course to be brought to the Kansas City area, and my request was denied. So I was like, all right, I really want to know this. I really want to help my patients. So I spent my own money and I flew down to Houston and I took Walt's course, and it literally was a game changer for my career with working with patients with head and neck cancer. And because of what I learned from him, I felt so confident coming back to work. And the program actually grew exponentially after that. And now, because of that, I was able to work with my supervisor to get Walt to come to Kansas City. So he's actually coming this coming August. And all the SLPs in the area are going to get trained in it. And I'm so excited because you just feel so good when you can actually see like the progress that the person's making, and like you're changing somebody's life, you know? It's not like just, oh, here, just do 3x12 effortful swallow. Like, no, you're actually like getting in there and you're working with the patient, and they're like in tears because they're going to go to Starbucks after your session with their wife, like for the first time in 5 years, you know? It's like stuff like that. Or like when you have a patient with aphasia who hasn't said anything, like, you know, the patient that I mentioned before we started the podcast that wasn't able to say anything, but I figured out that she could communicate with her eyes. Or, you know, I had a patient that had aphasia that couldn't say anything, but I figured out that she was Christian and she liked to pray before she had her stroke. So I held her hand, and her husband told me she liked to pray the Our Father, and she was literally able to pray the Our Father, but she couldn't even say her name. Like stuff like that. Like it is like, it just makes me really fired up. If you can't tell, because it's just like I've had a personal experience with my grandma having some of these things, and it's like I want, if my family member's in the hospital, I want somebody to be this like fired up about helping them, you know. And I think that like I said, if you just stay and you never learn anything and you never experience anything, and you just do the same job for 25 years and you don't go anywhere, you could get burnt out. But and you know, nothing against staying in the same place for 25 years. It's just all about continuing to challenge what you're doing. I mean, some people are still doing you know, DPNS and stuff like that, and it's like, or you know, just there's a lot of other things that people are still doing. But I just think that it's exciting to me to be proven wrong and to learn something new, because that means that I can better help my patients. So I actually enjoy when that happens, because I'm like I want to do what's best for the patient, you know.
Brooke, your patients are very lucky to have you. So thank you so much for answering our questions and our listeners' questions. If you would like to let them know where they can reach you.
Yeah, so I'm really active on Instagram. If you just search, I think my username is Brooke Beilman, so it's Brooke, and then my last name is Beilman, Beilman. You can find me there, and you can send me a DM. And I will say, if I don't reply, please DM me again, because sometimes I will read it in between doing something and then I forget to respond. And so you're not bugging me and I'm not ignoring you. Like, I just sometimes get busy, or I'll be squatting and then I'll look at it and then forget to reply. So DM me again. But that's the best way to get a hold of me, is through Instagram.
Do you have any upcoming projects you'd like to shout out?
Well, like I said, if things pan out with this head neck cancer specific thing, I will tell you guys more about that. I'm excited about that. Pretty much the main thing that I am working on right now is my blog, and just continuing to invest in people that are reaching out to me on Instagram, and then the handful of students that I'll be supervising. So yeah, that's about it right now.
Awesome. Thank you so much again for joining us. Please, for our listeners, tune in to next week's episode. We'll be talking about teletherapy and our personal experience with managing the teletherapy life.
It's been a new one. It's been a new life. So please remember to follow us. If you want to listen to the podcast on SoundCloud, our name is SLPeasinaPod. We're also on YouTube, SLPeasinaPodcast. And we also have our own individual Instagrams, as well as the SLPeasinaPodcast Instagram. You can follow Arva at ArvaTSLP, me at GracieZSLP, and Yuritsa at Yuritsa.
Thank you, everyone. Good night. Thanks again, Brooke.
Thank you.
Bye.
Bye.